As Vanuatu takes stock of the damage left by its third cyclone this year, and in the wake of Cyclone Gabrielle in Aotearoa, the New Zealand Medical Assistance Team and the New Zealand Defence Force are combining for the first time to test their response to a catastrophic event in New Zealand. About 50 personnel from both organisations are taking part in exercise Kotahitanga, currently being held at Trenton Military Camp in Upper Hutt and is ending this week. The exercise doubles as a World Health Organization assessment that the teams are operating to international standards, and Pacific Nations observers from Samoa, Fiji and also Australia are taking part. Koroi Hawkins reports.
The capital has been doing its bit this week to properly simulate wet and windy conditions for the men and women setting up this deployable health facility in Upper Hutt. But they're more than up to the challenge, and the NZDF commander of the Joint Support Group, Colonel Anthony Blythen, says it's a welcome opportunity to test themselves.
So it's been all about trying to learn what each other's capabilities are and how those capabilities may have opportunities to work together, but also to understand where they may not be compatible to work together as well. So we don't have a misconception about what people have or don't have.
The NZDF and the Ministry of Health have been working independently up to this point to develop their operational preparedness for disasters. The Director General of Health, Diana Sarfati, says seeing the combined response capability inspires confidence.
It's amazing to see it all out at the same time, but at the same time, if you are delivering high-level healthcare, there is always going to be a lot of equipment involved. Yeah, it gives me a lot of peace of mind to know that there are people that are prepared and trained to be able to respond if we do have a catastrophic event in New Zealand.
The impressive full setup of the deployable health facility is designed for the worst type of catastrophic event. Thankfully, this has so far not been needed. However, mobile elements of the setup and the personnel involved are regularly engaged across the country and the wider Pacific region for disasters. The New Zealand Medical Assistant Team's Dr. Alan Goody is just back from conducting training in the islands and says they're on standby now to assist Vanuatu in its response to Cyclone Lola if required.
This international effort to have these accredited teams is moving right across the Pacific, and there's two advantages to that. One is that the best response is always a local response, and the second is that they also can understand how to receive other medical teams and work together.
When the joint response exercise concludes on the 2nd of November, the New Zealand Medical Assistance Team also aims to have renewed its World Health Organization certification, which qualifies them to be deployed anywhere in the world.